Thank you, Mr. Mujiri, and welcome to you all, members of the press. I don't know how many we are expecting to be online there, or we can go ahead. Should we go ahead, Mr. Mujiri?
I think maybe they will register when we come to the question and answer.
Okay. So good morning to you, all members of the press, both here in person and those who join us virtually. Health sector stakeholders, development partners, civil society organizations, and fellow Zimbabweans. The Ministry of Health and Child Care has convened this press conference to provide a timely and transparent update on the state of access to HIV services across the country. In recent days, reports have been circulating on social media alleging shortages of critical HIV medicines, particularly antiretroviral drugs, that is the ARVs. Some of these claims go further to suggest that these life-saving medications are being sold illicitly. In addition, serious allegations have emerged concerning the extortion of patients living with HIV and AIDS by healthcare workers, especially in areas such as Chiredzi. The ministry takes these reports with the utmost seriousness they deserve. As the custodians of public health, we are committed to addressing these concerns openly and truthfully, while ensuring that the rights and dignity of all people living with HIV are protected. This morning, we will share verified information regarding availability of ARVs nationwide, outline the steps being taken to investigate and respond to the reported alleged misconduct, and present the measures being implemented to reinforce oversight, strengthen accountability, and improve service delivery across all levels of our health system. We reaffirm our commitment to ensuring uninterrupted access to HIV treatment and care, and to upholding the principles of equity, integrity, and professionalism in the delivery of health services. Our goal remains clear: to end AIDS as a public health threat in Zimbabwe by 2030, in line with our national and global commitments. There are a few questions that I will address. People are asking, what is the true status of ARV availability and distribution in this country? The Ministry of Health and Child Care manages medicine supplies using a minimum and maximum inventory control system, 14 months being the maximum stock level and 8 months the minimum. As previously communicated, ARV medicines are well stocked, and there is no risk of stockouts across all treatment regimens for this year 2025. On our current stock levels, adult first-line ARVs, we have 8 months of stock for those drugs. And for pediatric first-line ARVs, the ministry is phasing out older formulations while introducing a new fixed dose combination. The outgoing formulations are currently at 4 months stock, with shipments of the improved triple fixed dose combination expected in July, and that will provide 5 months stock from July. And on sustainability of these supplies, our antiretroviral therapy medicine requirements for 2025 are fully funded. While some partner-supported shipments experienced delays earlier this year due to the issuance of a stop work order from the US government, we responded swiftly and decisively. Through the National AIDS Council, we managed to mobilize domestic resources to close the gap and ensure an uninterrupted supply of life-saving medications, safeguarding the progress we have made towards achieving the UN AIDS 95-95-95 targets. The Ministry remains firmly committed to domestic resource mobilization as part of a broader strategy to build a resilient and self-sustaining health delivery system capable of withstanding both local and global challenges. There are also questions on what measures have been taken to investigate and address reports of corruption and exploitation within the healthcare system. We say zero tolerance to corruption in patient care. The Ministry is gravely concerned about credible reports of healthcare workers allegedly extorting patients living with HIV/AIDS, particularly in Chireds. This conduct represents a gross abuse of authority, a violation of ethical standards, and a betrayal of public trust. We unequivocally condemn such reprehensible and corrupt behavior. Investigations are underway, and any healthcare worker found guilty will face swift disciplinary action. No one entrusted with the duty of care should ever exploit the vulnerable. As a reminder for the public, ARVs are available and provided free of charge. If any patient is asked to pay for HIV services, they should immediately report the incident to the Provincial Medical Director, the District Medical Officer, the Zimbabwe Republic Police, and they should also report to the Minister's Office. I have got Mr. Neshava here who will be taking all those reports so that we can act from the Ministry. Our commitment as the Minister of Health and Child Care, we remain unwavering in our commitment to uphold the rights of all patients, guarantee uninterrupted access to HIV treatment, and safeguard the integrity of Zimbabwe's public health system. The significant progress made towards achieving the 95-95-95 targets will be protected and advanced and not reversed. On issues concerning HIV drugs, I think I end there. I also want just to update you as members of the press on what we are doing as a ministry in terms of hospital equipment and other response projects. As part of the Response and Essential Health Services project, hospital and maternity waiting home equipment and furniture have been procured with support from the World Bank's Global Financing Facility. The procurement was carried out by CODAID, the project implementing entity, at the request of the Ministry of Health and Child Care. Currently, 90% of the equipment is at NatFarm, with deliveries to healthcare facilities having commenced on 30 April this year. The remaining items are expected to be delivered by 31st May, this month. This allocation covers 25 theaters and maternity waiting homes across the country. The support also includes installation and training, which are scheduled for completion by the project's end date of 30 June 2025. Maybe I'll just go through some of the equipment that has already been delivered to our health facilities across the country. We have got 25 anesthetic machines, which have already been delivered, 50 manual delivery beds, 25 manual operating theater tables, 25 overhead suspended operating theater lights, 25 double bottle electric suction machines, 23 full blood count machines, 15 chemistry analyzer machines, 25 digital patient monitor machines, 25 steam sterilizers, 25 neonatal resuscitation trolleys, 50 infant incubators, 50 phototherapy machines, 25 ultrasound scan machines, 100 fetal Doppler machines, 25 LED viewing boxes, 700 drapes. These are materials for use in theater. 50 cesarean section packs, 90 delivery packs, 25 electrosurgical units, 50 infusion pumps, 25 digital baby scales, 25 manual resuscitators, 25 CTG monitors, 125 pulse oximeters, 50 bilirubinometers, 250 hospital beds, 50 heavy-duty digital BP monitors, 25 wheelchairs, 125 three-seater airport benches, 50 MUAC tape, 50 thermometers, and all these have been delivered. And the total cost for all this is $3,685,552 United States dollars. And these have been delivered to 25 health institutions across the country. And I'll just name the list for those who would want to verify. In our last meeting, some people were saying, why didn't you tell us where the anesthetic machines are? So I'll list the hospitals where these machines have been delivered. And all these items that I've mentioned, all the items, one by one, are delivered at each institution. So it means the whole list can be found at one institution. So, and the 25 institutions have all this equipment. That is Gokwe South. There are 25. Gokwe South, Munene Mission, Murambinda, Marange Hospital, Hauna, Mashoko Mission, Chikombedzi, Musiso Mission Hospital, Matibi Mission Hospital, Chidamoyo, Sanyati, Father Ohia, Siakovu, Sadza, Mutoko, Mtawatawa, Norway Mission, Chitsungo Mission, Marymount, St. Albert's, Mount Darwin, Inyati, Nkai, Manana Mission, and finally St. Anne's Brunapeg Hospital. The delivery and handover of hospital and maternity waiting home equipment under the Zimbabwe signifies a major achievement in enhancing the country's healthcare infrastructure. So I thought I should just also add, because people think there is nothing happening. I want to assure you that even under the difficult circumstances that we are in, the Second Republic is delivering on the health sector. I thank you.